Very good evening, everybody. Meeting again in the session of philosophy, and we're discussing new chapter from H.A.Robert's philosophy. That is chapter number 27, the syphilitic miasm or syphilitic stigma continued. And in this specific chapter, he tried to correlate the syphilitic miasm in relation with the Psoro-Syphilitic miasm, that is the tubercular miasm. And at many levels, you'll find that whenever these two miasms, Sora plus syphilis, gets united together, at that time, always there is a dominance of Sora over the syphilis. And that's why you have many pathologies where functional symptoms are associated along with pathology. Then definitely it is a specifically tubercular miasm which is persistent. So tubercular miasm has one ingredient is syphilis, but Sora always dominates over the syphilis in such combination. Very occasionally, specifically the things are at mental level. Many times syphilis dominates with the Sori. Otherwise, you're going to get more commonly the Soric dominance over there. Yesterday, we have seen certain aspects of it. He has started explaining about same thing, and then he explained that earmarks of all three miasms, the Sora itches, and there is a tremendous itching and irritation, unwashed appearance. Second, psychosis, there is a infiltration over there in psychotic miasm and deposition, that's why growth is there. And third, syphilitic, the destruction, the destructive process which we have seen. Then he started explaining about that Sora has very occasionally the objective symptoms. More commonly, the Sora has subjective symptoms. When it unites with other miasm, then and then only this Sora starts showing the structural changes. Otherwise, Sora alone cannot produce a structural problem. Then he started explaining about certain specific entities related with syphilitic miasm and comparison with the tubercular miasm. One of the thing which is very prominent in syphilitic miasm is aversion to meat. But when you compare it with the Psoro-Syphilitic miasm, that is tubercular miasm, there is a great craving for the meat, along with many things. Craving for indigestible things is there. There is craving for very potatoes, then craving for the mud, craving for inedible things, all those things which are very commonly present. And last paragraph, which we have discussed in yesterday's lecture, that is page number 219, that he has given one simple example that if this tubercular miasm is present over there, specifically in respiratory symptoms, there are structural changes along with some functional manifestations, but there is a shallow breathing which happens to be there. Patient is not able to take a deep breath over there, and that's why the oxygenation is lacking and patient has a very less oxygenation. These patients, specifically when it is syphilitic specifically, then these patients are feeling comfortable inside the closed room because they are accustomed to the low levels of oxygen. And this is what we have discussed over there in last lecture. Let us go ahead with the next paragraph, 219 page, the next paragraph over there, third paragraph. Long before tuberculosis develops, sometimes even years before, you may notice a symptom of the latent diathesis. On the least exposure to cold, the patient develops a deep hoarse cough, and this will be repeated many, many times before the actual development of tuberculosis. The purely syphilitic patient has short barking cough, and this is sometimes true of early tubercular changes. See what he is explaining. In the pre-tubercular stage, when tuberculosis is not yet happened, but pre-tubercular stage, the person is having recurrent cough which is exhausting, causing more damage to the patient's health, and the patient will going to get more and more cough day by day. It is increasing in tendency, and ultimately structural changes when follows, then you will going to get, yes, patient has a tuberculosis. So this is very clear regarding it that in pre-tubercular states, you get more commonly a simple common coryza followed with a recurrent cough over there. And when this recurrence persists, it leads toward the structural manifestation of it. See, here also the law of biological development works. It produces the functional symptoms first and followed by structural change. Functions creates the organs. That's the law, and this is applicable everywhere. When disease has to happen, the same thing happens. You get the functional symptoms more commonly first, and then followed by the structural changes over there. The tubercular expectoration is purulent, greenish yellow, often offensive, usually sweetish or salty to his taste. We can usually depend upon salty or sweetish taste as being characteristic of this dyscrasia. So expectoration has very specific taste. It has sweetish, saltish taste. See, very important. The expectoration is purulent in nature. It is greenish yellow. Many times yellowishness is more marked than greenish. Greenish is very characteristic of psychotic miasm. And third important thing that there is a sweetish taste of the expectoration along with the salty taste. Sweetish salty taste you can get over there in chapter repertory, the expectoration, and you get the sweetish taste and salty taste over there. And you will get more commonly tubercular remedies over there. There is everlastingly tired feeling of the tubercular type. The psoric is always ready to lie down. The tubercular patient is better in daytime, worse at night, worse as night comes on, showing syphilitic influence. See, here also the two important things which he is mentioning. The patient feels better by lying down, better by rest. That is typical of the psoric influence. Psora dominates over syphilis. But when you consider the modalities, here the syphilis dominates over psora. The tubercular patient generally gets aggravated at night, and that is the dominance of syphilitic miasm. Syphilis always gets aggravated at the night. The syphilitic patient should be sun worshippers in type, and for they are always better during daylight hours, and all conditions are aggravated at night. Syphilitic patient, you get this very commonly. They always gets aggravated at night. There is one more feature, artificial light aggravates of the syphilitic miasm, whereas psora has a daylight aggravates. The syphilitic dominance you can see in tubercular patients, they are also gets aggravated at the night like syphilis, and they are day worshippers. They want when the day will come, and they are waiting for the daylight. The tubercular patients, the tubercular people suffer from neuralgias. See, all the manifestations of tubercular miasm, neuralgia, prosopalgia. Prosopalgia means pain in facial muscles, face. Sciaticas, insomnias, hysterias, and all the nervous symptoms peculiar to the diathesis. You write it down one by one because these are very important. Neuralgias, prosopalgias, the sciaticas, the insomnias, the hysterias, all nervous symptoms. So neurological symptoms having functional manifestation at the same time along with the structural changes, both are there in tubercular miasm, but these functional manifestations always represents the miasm in tubercular patient. Peculiar to this diathesis, they may have years, the persistent headaches, chronic headaches, migraine, always comes in this specific miasm. This may precede the actual tubercular development. Hysterical and other nervous symptoms often precede the tubercular manifestation, and when the lung condition improves, the hysteria will return. So prior to the tuberculosis, they always suffers from hysterical manifestations. Hysterical manifestations are always functional. There is no structural change, but if it recurs and persistent, and if it is suppressed, then it can lead to structural damage, and patient may enter into tuberculosis. But if you treat the tuberculosis, the hysteria may return. This is what he is saying. When the hysteria improves, the lung condition takes on renewed activity. Often the severe dysmenorrhea will stay for a time. The disease progress in the lung itself. So see here again one more example. When two dissimilar diseases meets inside one human being, if one is dominating or one is strong, the next one gets temporarily suspended. This is what upon a severe dyspareunia will stay for time. Disease is progressing in lung itself. In other words, pre-tubercular manifestations are more soric than syphilitic, but the structure predisposing to develop the lung condition is syphilitic. So see, in this miasm, you get both manifestations, the soric as well as the syphilitic. The functional manifestations are soric, but structural changes are syphilitic. And that's why tuberculosis, if not treated properly, leads towards the destruction. So this is how it goes. It goes towards the destruction day by day. And that's why in tuberculosis should be treated very, very clearly. Otherwise, it leads toward the problem. Question arises, if you are treating the tuberculosis with homeopathy, is it possible? Many students ask this question. Tuberculosis is very clearly treated with the help of homeopathy if you get a right remedy. But there are certain caution which you have to look for. First important thing, you should not use in active tuberculosis three main remedies: the phosphorus, the kalicarbonicum, and basically nosode tuberculinum. These are three you should not use during the active phase of the tuberculosis. During active stage of tuberculosis, there are other remedies in our Mater Medica which are very useful and which can treat that patient very fast as compared to the anti-tubercular treatment. R-iodide is one of them. Second is Acalipha indica. That is also one more remedy which is very, very useful in such types of stages. So we have a proper treatment of tuberculosis in homeopathy. So there is always not, but you should be confident enough to treat that, and you should be very confident about your remedy. That's the matter when you deal with the tuberculosis. If you don't have that confidence, it's better to give the anti-tubercular treatment. But whenever tuberculosis is healed with the allopathic medicines, that is anti-tubercular treatment, the rifampicin, the ethambutol, the pyrazinamide, all those drugs, isoniazid, all those drugs are there. At that time, fibrosis is much more. And if fibrosis is much more, when it heals, the lung capacity becomes less because that part of the lung will not be useful forever, and that's why it gets affected and lung capacity remains less, and these people are sufferers for the common cold and cough again and again. That's the thing which happens. But if you treat it with homeopathy, this fibrotic tendency becomes more or less, and you get more commonly a more space of lungs to be utilized. So these are things one must know when we treat homeopathically such a condition. When children cry out in their sleep, we may take these to be an indication of tubercular diathesis, which may take on a meningeal form, which it develops. So meningitis, in case of meningitis, there is one typical feature. It is called as cry encephalic. Do you know the remedy? Which is the remedy? Cry encephalic. We have learned this remedy. Cryencephalic is a very characteristic manifestation of the helleborus. You can get it in helleborus, cryencephalic. There are many more remedies which have meningeal irritation, and all those which acts on meninges and produces irritation always produces a cry. And that cry specifically disturbing them at during the sleep, and it comes out of with a very severe cry during sleep. Look carefully to all night aggravations, especially in children, to see if they are not pre-tubercular indications. So such types of indications, patient is getting aggravated at night, patient is having patient starts during sleep, patient cries out during sleep. This itself shows that it has a meningeal irritation, and that's why it happens. Even in worms, one manifestation this happens. Sena is one of the important remedy where the patient turtles during the sleep. and they cry out during the sleep. And that shows the meningeal irritation because of the worms in case of children. The tubercular diathesis has many heart symptoms showing psoric parentage. See, this is very important. There are structural changes in the heart, but along with many functional manifestations also. There is much palpitation. Patient comes to you again with the same symptom. They have little bit something happens and they comes to you with palpitation or chest embarrassment. In the psoric, this is due to the uterine or gastric irritation and the disturbances. In psychotic patient, the heart manifestations are reflexes of rheumatic condition. Rheumatic heart disease, it is always psychotic. You start with it is a psychotic, it ends with syphilitic. You get the remedy, rheumatic heart disease. There are two important remedies. Anyone knows which are two important rheumatic heart disease remedies? In fact, three. First of them is the Calmia latiafolia. That is very important rheumatic heart disease. Second important remedy which comes over there is the lithium carbonicum. And third important remedy which comes over there is the naja. These are very important remedies in the rheumatic heart disease. All of them are psychotic in my. So psychotic miasm, the heart symptoms, there are structural changes over there. And that's why valvular heart troubles, it is very important psychotic manifestation. One remedy which is not well proved but has many structural heart problems is Adonis vernalis. That is also one of the important remedy to be think of in rheumatic heart disease. So psychotic miasm, these are the remedies which you can think. So in the psychotic patient, the heart manifestations are reflexes of rheumatic condition. In the syphilitic and psychotic stigmata, we find little mental disturbance accompanying the heart conditions, even when conditions are critical. Patient never complains of many things. He has directly a structural damage. So mental symptoms related with the heart complaints are very less and patient is suddenly off. That is the characteristic of psychotic heart disease or syphilitic heart disease. There are no manifestations. Patient never complains, I have chest pain and embarrassment and I'm not feeling well and palpitation. He never complains. Complaining is very less in both miasm. They have structural changes and all of a sudden patient dies in psychotic and syphilitic. But in psoric, there are n number of symptoms and these patients will going to lie alive for longer time of durations without anything. In the syphilitic and psychotic stigmata, we find little mental disturbance accompanying the heart conditions, even when conditions are critical. It is the psoric patient who worries about his heart condition and rarely succumbs to it. Succumbs means badi padne, to get lost. So Sora never going to get lost with the hearts, even though he has many heart symptoms, because there are no structural changes. It is syphilitic or psychotic patient who may have years, a slight dyspnea and occasionally slight pains and perhaps no symptoms at all, but they die suddenly without warning. And this is very characteristic of psychotic and syphilitic teens. Patient has those structural changes in their heart and it was not recognized because they don't have symptoms. You get this type of news many times. He was absolutely normal, playing everything normal, and nothing has happened, and no chest pain, and suddenly he was off. It indicates he might have a psychotic or syphilitic tint in him. He never had a psoric miasm. Sora comes to your OPD off and on. He always asks, doctor, please check my blood pressure. He always asks, please my pulse. Even he is very familiar of checking his own pulse. Very typical psoric patient. They are always anxious about their heart, and they always keep their hands on their heart and they checks and say, doctor, I got the palpitation and all those things. Please check and look after me. Many symptoms. All are functional manifestations of the psoric miasm. They will complain, but they will not have anything over there. One more paragraph will finish. In the tubercular, as in the psoriatic heart condition, the patient will want to keep still. They are much aggravated by higher altitudes, cannot climb stairs and ascend hills, cannot breathe well on ascending, have not proper amount of room for air. They have no difficulty in descending. So in tubercular patient, how is the heart? Ascending stairs the aggravates. They get the breathless because lung capacity in tubercular patient is very less, because of which breathlessness follows whenever they start climbing upstairs. So they rises for few footsteps, then they wait, then again they rises for few footsteps. This is how they go. This is the characteristic of manifestation. But when they descends, there is no problem. They have no difficulty in descending. With this heart condition, there is a cyanosis that is often painful. So in such types of patients, cyanosis is one important manifestation. There is gradual falling away of flesh in this condition. So patient is putting down his weight day by day is the characteristic of it. The syphilitic dropsies and anasarcas are greater than psychotic. So this is one more feature. This indicates the cardiac failure, and because of cardiac failure, the generalized dropsy, anasarca, which develops over there, is characteristically syphilitic manifestation. It is more than psychotic. It is more commonly because of cardiac failure. It is not because of renal failure or kidneys at fault, but it is more related with the cardiac problems. So these are the very specific manifestations of syphilitic miasm, at the same time Psoro-Syphilitic miasm. He is comparing these two miasms everywhere, and we are getting all those differences very clearly in those chapters. So why to read the Robert? Robert gives you a whole perspective about the miasms and their comparison, and because of which it becomes rather simple to understand the miasm and lead towards the proper remedy when treating the patients. So my suggestion to all the practitioners and all students that must go through the Robert's philosophy and Kant's philosophy in order to learn the miasms. You'll be very clear about will have very clear understanding of it, and because of which it becomes rather simple to prescribe. So we'll stop on this note, and tomorrow we'll meet again at the same time with the next part of it. So thank you and good evening, everybody.
Thank you very much, sir.
Thank you, sir.
Thank you.